Hello, my name is Mark. I'm with SecureCare Products. We're based in Concord, New Hampshire. We were the very first on the planet to develop a transmitter-based monitoring system, and that's used for infant and pediatric security, as well as long-term care, wandering resident management. And if I may, I'll just show you a couple of the components. This is a door panel. So one of these will be placed at every door, every elevator, every exit that you'd like us to monitor for you. And in so doing, it creates a secure perimeter. Now what happens is, as an example with infant or pediatric security, they would wear one of these active transmitters around the wrist or around the ankle. And when one of these transmitters is brought into proximity to the door panel and penetrates that protective bubble that's now been formed around that door, as you can see, lights come on to indicate that that door is now locked and armed. And back at the nurse's station PC, there will be a yellow alert that indicates where that baby is, what door, what exit, and even what room that baby is assigned to with mom. Right? Now we can take that a step further. If that door is in an open position and the baby and its transmitter penetrate that protective bubble, as you can see, there's an audible and visual alarm at the door. And back at the nurse's station PC, there's now a red banner indicating that that door is open, and that represents a way that that baby can be removed from the secure perimeter of that unit. I'll just clear the alarm. Okay. Now we also have a mother-baby matching system to make sure that the right baby is presented to the right mom. And ours is really unique in the sense that the notification takes place outside of the mom's room. Because there's usually just one mom in a room, private rooms, all the nurse would have to do is pause outside of the door with the baby in the bassinet, and just look for the green light that will come on there to indicate that that is a match. It's the right baby for the right mom. And if I were to just give that a moment to clear, I can then bring in a baby that's not a match. And I'll do that in just a moment. And you'll see a red light will come on. And what that indicates is that I have the wrong baby. So rather than this take place in front of the mom, in front of the parents, in front of the grandparents, and whatever, this all takes place very discreetly outside of the mom's room, without any embarrassment to the staff and a loss of confidence on the part of the family. So the nurse can just, as you can see, the red light is on, the nurse can just back away and go back to the nursery and regroup. And of course, administration can be notified that there may be an issue that they need to take care of in terms of the protocol that they follow. Now, this is also available for long-term care facilities, nursing homes, and so on, or any place where there might be patients who have some kind of cognitive disorder, whether it's dementia or Alzheimer's, to make sure that those residents cannot wander outside of the secure perimeter of the facility and perhaps elope or be lost and can suffer injury or maybe even death if they're exposed to the elements. So that is infant and pediatric security, as well as wandering resident security that's offered through SecureCare Products, and our local distributor is CEC.